Good morning, Tampa Bay's Morning Blend viewers. Today we're coming at you from the Florida Cancer Specialist and Research Institute. I'm joined by Dr. Shailene Shaw, and we've been kind of talking about personalized medicine. Maybe you've seen it on commercials or heard about it. It's kind of a buzzword right now, but you guys are really taking advantage of the idea of personalized medicine. How are you doing that?
The idea behind personalized medicine is that we're trying to stratify patients into various groups so that we can offer more precise, powerful, and predictive medicine. It used to be that, and it has been even now, where medicine's often been reactive. You get a disease, you're diagnosed with something, then you get treated. The idea behind personalized medicine is looking at the genetics of the tumor, the genetics of the person, and then identifying these patients, putting them into certain groups so that we can then offer medicine that's specifically aimed at that person's tumor and or based on their own genetics. It's definitely where all the research is going. There's an intense amount of research occurring right now for this, and we're expecting bigger and better things as time moves along, I would say.
Well, you were talking about the genetics of a tumor and the genetics of a patient. That kind of brings us to genetic testing, another buzzword we're hearing a lot about. How are you able to implement that, and what should viewers take into account when it comes to genetic testing?
And what we do is we take a family history of a patient. So a patient comes in, they give us their family history. Then we stratify that risk, again, based on their family history. And if we identify that a person has a certain cancer with a genetic basis, then what we're able to do is say, hey, you might benefit from genetic counseling and testing, and then we can do some, testing along those lines. So for example, if, Angelina Jolie, right, she's, God bless her, she's put a face to breast cancer and genetic, BRCA1, BRCA2 gene testing, and that seems to get all the headlines, and she's done a great job with it. But what we do in that sort of scenario is someone comes in and they say, gosh, my mother had breast cancer at the age of 40. My aunt had it at the age of 45. My other sister had ovarian cancer. Well, you know what? That might tell us, hey, we should do genetic testing on this particular patient. And if they return positive, the interesting thing then is then we can take that one mutation that's positive, for example, and then test that patient's siblings, parents, kids. And then based on that, you can say, hey, well, you have something. Let's say their patient's daughter has it. Then we can say, well, based on the fact that your daughter has it but has never had breast cancer, now we know that they should start their mammograms at a certain age, self-breast examinations, clinical breast examinations, and so on and so forth. So we're able to utilize all that information now and then, offer patients better screening, basically.
Well, and I hate to kind of put you on the spot, but I mean, I'm sure people are probably watching this thinking, well, I checked this one. Is there kind of a checklist you can share for people that may have something and think, yeah, maybe I should look into the genetic testing here at the FCS?
If you have a family history of malignancy, and you're not sure at all, I think you have to reach out to your doctor, maybe your primary care doctor. And that doctor may say, you know what, I'm going to refer you to a genetic testing or genetic counseling place. Or they may refer you to someone like me. Here at Florida Cancer Specialists, we're all pretty well versed in this. So, someone comes to me, I can drive them in the right direction to get the appropriate testing done. And then, see what the data shows.
Okay, well, Dr. Shaw, a hard man to get a hold of with your busy schedule, so thank you for sharing your time with us. We appreciate it. And as always, if you want any more information, just be sure to go to tbmorningblend.com.